Swadika, very good evening and welcome to Thai PBS World Tonight. I'm Nabunag.
I'm Tulip Naksompoplao.
And today we will begin the program with the Phuket Sandbox, which is highly anticipated because it's only a week away, right? And you recently interviewed the Phuket governor as well.
Yes, we had a chance to talk to the governor, Narong Wunsil, which is really busy right now because it's in the preparation process for the sandbox that will start July 1st, which Thai PBS World will be there for you. So here's a story about Phuket Sandbox. They think it will be a very good start to revive the tourism, start off with Phuket, and then of course it will go on for Thailand. And let's take a listen to this story.
แต่ว่าถามว่าปัญหาอุปสรรคก็เป็นเรื่องปกติธรรมดาในการที่จะเราเป็นจังหวัดแรกๆหลายเรื่องเนี่ยเราก็ต้องมาลองกัน
The governor of Phuket, Narong Wunsil, told Thai PBS World when we asked whether he feels the pressure of being the first province in Thailand to reopen to fully vaccinated foreign arrivals without quarantine in July under the tourism campaign called Sandbox. Narong said Phuket is determined to make it happen and that if Phuket does not take this path, the future of island and the livelihoods of people here, which very much depends on the tourism industry, would be crippled. 80% of Phuket's revenue came from tourism, worth over 442 billion baht. When the world was on lockdown, Phuket saw only 10% occupation of its 100,000 hotel rooms. Phuket earned just over 108 billion baht in 2020, 91% of which was in the first 3 months of the year before lockdown. The governor said one of the indications that Phuket's people are determined to make this project work is that many people are very enthusiastic about getting vaccinated, and people have been very cooperative with the disease control measures, which has resulted in very low numbers of new locally transmitted cases or even 0 new cases on some days.
วันที่1 กรกฎาคมขึ้นมาเนี่ยภูเก็ตพร้อมประเทศไทยพร้อมและโลกต้องพร้อมมีการนำนักท่องเที่ยวเข้ามามีการเตรียมการตั้งแต่ที่อยู่ในประเทศต้นทางอยู่แล้วซึ่งตอนนี้ทางสบคก็ได้มีการประชุมผ่านเห็นชอบในหลักการไปแต่ว่าจะต้องเข้าครม.และต้องออกมาประกาศเป็นราชกิจจาออกมาราชการนุเบกษาออกมาซึ่งตรงนี้เมื่อมีความชัดเจนแล้วเนี่ยจะทำให้เป็นแนวทางปฏิบัติที่ทุกฝ่ายมาช่วยกันทำงานในเรื่องนี้ครับแล้วก็เราต้องตอบคำถามว่าเมื่อเปิดเกาะมาแล้วเนี่ยคนภูเก็ตได้อะไรประเทศไทยโดยส่วนรวมได้อะไรซึ่งอันนี้ก็หมายถึงว่าเป้าประสงค์ที่เราต้องการให้เกิดขึ้นมาแต่สิ่งที่ภาพที่ไม่ต้องการให้เกิดคือเมื่อเปิดเกาะขึ้นมาแล้วกลับต้องมาปิดเกาะอีกทีนึงเนื่องจากว่าไม่สามารถควบคุมโรคได้
Under the Sandbox scheme, visitors have to stay at the same hotel for 14 days, but they are allowed to travel anywhere on the island with a tracing system. Narong said there will be a system to make sure all travelers stay in Phuket until they complete the initial fortnight. All the entry points to the island will be tightened. The checkpoint system on land will be improved to the same standard as at the airport, with health officials and the screening process for both people and other objects.
ก็คือว่าเข้ามาแล้วเนี่ยจะไปตรงไหนก็ได้แน่นอน14 วันเนี่ยให้อยู่ในภูเก็ตแล้วก็ตอนนี้วางมาตรการเข้มข้นว่าไม่ได้ออกแน่นอนถูกไหมคะ
ครับพยายามครับแต่ว่าเราไม่รู้ว่าความพยายามของคนที่จะหนีออกไปกับความตั้งใจของเราที่จะควบคุมเนี่ยได้ขนาดไหนแต่ว่าเราคิดว่าเราน่าจะได้รับความร่วมมือที่ดีนะครับ
Sandbox is a big project for Phuket, but they still hope to see 500,000 domestic tourists in the next 3 months, which accounts for 80% of the visitors they're hoping to welcome. The governor assured Thai PBS World that the same conditions apply to Thais and foreign residents in Thailand. Fully vaccinated visitors are always welcome. Otherwise, the visitor has to take the rapid antigen test before they come onto the island.
ตอนนี้ตัวเลขที่ชัดๆจริงๆเนี่ย ในส่วนที่เรายังไม่เห็นแต่ว่าจากการที่ได้พูดคุยกับทางททท.สำนักงานภูเก็ตก็ดีทางสมาคมธุรกิจท่องเที่ยวภูเก็ตก็ดีเนี่ยเรามีตัวเลขว่าเป้าก่อนนะครับตาร์เก็ตเขาก่อนเนี่ยทางททท.ตั้งเป้าจะนำนักท่องเที่ยวชาวต่างชาติเข้ามาในจังหวัดภูเก็ตในช่วง3เดือนนี้นะกรกฎาคมสิงหากันยายนอยู่ที่ 129,000 คนเศษ 129,000 คนเศษแล้วขณะเดียวกันก็จะมีเป้าหมายนักท่องเที่ยวชาวไทยประมาณ 500,000 คนที่จะเข้ามานะครับ
Currently, the information Narong has in hand is from Tourism Authority and the business sectors. On July 1st, there will be flights arriving from Doha, Israel, Singapore, and Abu Dhabi. Fewer than 10 days from reopening, however, the regulations for entering Phuket remain unofficial. They need to be published in the Royal Gazette first. Narong said then, Phuket expects to see a rise in bookings and confirmations, possibly in the middle of July. Travelers will start planning their trips once they have a clearer picture. Tulip Naksomphop Plau, reporting for Thai PBS World.
So the governor said that Phuket people are very enthusiastic about vaccination. So right now, about 50% of Phuket residents are already fully vaccinated, and another 25% already have their first dose.
And it looks like Phuket is ready to welcome foreign tourists in just a week away. And now let's move on to the latest on the COVID-19 situation in Thailand. With the Delta variant, which is highly of concern at the moment, so far around 661 people in Thailand have been infected with the Delta variant of COVID-19 from April until June 20th, and the number is likely to increase. And this is according to Dr. Supakit Sirilak, Director General of the Department of Medical Sciences. At the same time, 5,641 people were infected by the Alpha variant and another 38 by the Beta variant. Dr. Supakit added that most Beta variant cases have been found in the southern part of Thailand. The Thai Health Promotion Foundation posted on its Facebook today saying that the Delta variant may show similar symptoms to other strains, namely those similar to flu, such as headache, sore throat, and or a runny nose. However, anosmia has not yet been found with this variant. Meanwhile, those with the Alpha variant may experience fever, cough, sore throat, breathing difficulties, headache, anosmia, a runny nose, fatigue, body aches, vomiting, and or diarrhea. And now let's have a look at the COVID-19 figures. Thailand recorded 51 new COVID-19 related deaths today, which is the highest daily death toll since the pandemic started last year. At the same time, 3,174 new infections were also recorded, raising the cumulative total since April to almost 200,000. So it's 199,676.
So because we have several thousand new cases every day, so that means we have a lot more of these severe cases that will need hospital beds and probably will need ventilator as well. So today the subcommittee of the CCSA, or the Center of COVID-19 Situation Administration, just addressed the hospital bed shortage and around the country and also in Bangkok. The subcommittee of the CCSA set to discuss the problem of a lack of hospital beds at the state and also private hospitals to accommodate the increasing number of severe COVID-19 cases. General Natapon Nakpanit, he is the head of the CCSA panel, said that the Prime Minister, Prayut Chan-o-cha, is concerned with reports that several hospitals are running low on available beds and wants the Ministry of Public Health to address the problem and, if necessary, seek help from military hospitals. In the coastal province of Samut Sakhon, it is reported that Samut Sakhon Hospital, the Krathum Ban Hospital, and Ban Pao General Hospital now have a combined number of 63 unoccupied beds out of a total of 541. So private hospitals in the province also reported that their combined 873 bed capacity is now almost full. Hospitals in the coastal province have been providing treatment to local COVID-19 patients as well as those transferred from other provinces, including Bangkok. The province also has a large field hospital. Dr. Inoculation of French, the director of Samut Sakhon Hospital, said that more severe cases are being admitted in the third wave of pandemic, which started in April 2021 compared to the first two waves. The Medical Services Department has also expressed concern over the prospect that all hospitals in and around Bangkok will run out of beds to accommodate new severe cases. For instance, 268 beds in negative pressure ICU rooms are now occupied, leaving 46 still empty, whereas 689 beds in modified negative pressure ICU rooms are almost filled up, with just 68 available. For the less severe cases, 3,529 beds in separate rooms have been filled up, leaving 527 unoccupied. There are also another almost 1,500 beds that are available for the less severe cases, as 6,582 have been occupied. So for beds in hospitals and field hospitals, there are over 3,200 and 803 beds still available, respectively. Medical Services Department Director General Dr. Somsak Akasin said that there are about 200 private hospitals in Bangkok, and each of them has 1 or 2 ICUs that they do not have sufficient staff to look after all the COVID-19 patients. So to tackle the hospital bed shortage, he suggested that the Bangkok Metropolitan Administration and community leaders adopt a bubble and seal measure in each community to separate the infected. In case of the elderly people, Dr. Somsak said that they should be given vaccinations before they are transferred to hospitals, and that all bedridden people must be inoculated too, adding that the new infection rate must be reduced as quickly as possible, otherwise the existing health system will be overwhelmed. He also advised the general public to restrict their movements and to strictly observe the safety measures adopted by the Public Health Ministry. Meanwhile, the CCSA spokesperson, Dr. Thwisin Wissanuyothin, said that as most patients are in Bangkok and nearby provinces, some have to wait for hospital beds. People who are asymptomatic and those with mild symptoms can move to hospitals for treatment. He admitted that state hospitals in Bangkok and nearby provinces are full, while private hospitals are also experiencing shortage in beds. As most of the current COVID-19 cases are in Bangkok and nearby provinces, some people are still waiting for beds. People who are asymptomatic and those with mild symptoms can move to hospitals for treatment. As for people with moderate or severe symptoms, the Bangkok Deputy Governor will hold a meeting to discuss the increase of hospital capacity to accommodate them. So this come back, and I think it's just several weeks ago that we have these issues of the shortage of bed, or the news of the bed shortage, that some said it's really happening and some say that we're not really short of beds, but seems like it is going to be the reality now very soon.
Exactly. And due to the COVID-19 situation, which hasn't really improved, especially in Bangkok, where most of the new infections were, a senior doctor has suggested a 7-day lockdown of Bangkok to curb the spread of the coronavirus, as the number of new infections are still increasing. Describing the situation as desperate without many options, Associate Professor Dr. Nithipat Jiankun, Chief of the Respiratory Disease and Tuberculosis Division of the Faculty of Medicine at Sirirat Hospital, posted on his Facebook today that daily new infections keep increasing in the capital, with a likelihood they will rise well into the thousands per day. He also stated that the discovery of new cases in hospitals accounts for over 10%, and that more children, elderly, and those with high-risk diseases are being found infected during this wave than during previous outbreaks, signaling that the pandemic has spread further into communities. Dr. Nitipat said that the situation will lead to a shortage of hospital beds with less than 5% capacity remaining. This means that the beds will be allocated mainly to severe cases, displacing those with less severe symptoms who will then need to be treated somewhere else. He said the lower standard of treatment received may lead to yet further spread of the virus. The doctor said that the short answer to preventing the fourth wave of COVID-19 infections is to lock down Bangkok for at least 7 days to fix the existing issues and to prevent other problems from developing. Most importantly, if the lockdown is imposed, people in Bangkok must be banned from traveling to other provinces, which authorities failed to ban during the Songkran holidays. Previously, Dr. Nitipat has voiced his concern over the premature reopening of Thailand to foreign visitors in 4 months, as announced by the Prime Minister last week, pointing out that the mass vaccination of 50 million people in the country should not be the only consideration when making such a decision. So we can see that many of the senior doctors are showing their concern about the reopening and the current situation of COVID-19 with the new infections increasing. They are really concerned that there might be bed shortages as well.
Yes, and for a lot of countries, not just Thailand, one of the factors that they use for considering whether they should reopen the country, whether they should ease the lockdown, scrap the mask wearing measure, is how many people got inoculated. And in Thailand right now, we have AstraZeneca, we have Sinovac, and we have Sinopharm coming in. And for AstraZeneca, if you remember, just not too long ago, Thailand actually advised to expand the interval between 2 doses to be 16 weeks. But now it's changed again. Thailand's National Communicable Disease Committee has decided to move forward the administration of the second dose of AstraZeneca vaccine to 8 weeks instead of previously 16 weeks. And 10 to 12 weeks as originally planned to address the spread of the Delta variant of COVID-19. Public Health Permanent Secretary Dr. Kietiphom Murajit said that on June 14, the NCDC decided to set the interval between doses of AstraZeneca at 10 to 12 weeks, which could be extended to 16 if necessary, because the spread of the Delta strain had not yet been detected. Since the Delta variant has now been found to be spreading rapidly, as reported by the Medical Sciences Department, he said that the NCDC has decided to readjust its vaccination strategy in areas where there is a high Delta variant infection rate by shortening the interval to only 8 weeks. So recently, Sirat Hospital also announced its rescheduling of its inoculations from 16 to 12 weeks for those who received their first dose of AstraZeneca vaccines between June 7th to 18th. For example, those who received first dose on June 7th and now received their second dose on August 30th. The rescheduling is in accordance with the Communicable Disease Committee. So hopefully this will be the last time they change. We actually, when they announced that they will expand from 12 to 16 weeks, I was trying to get into contact with the AstraZeneca to get some explanation whether there is any side effect. And the answer I got is that there is not enough study to be able to say whether extending the interval between those 2 doses will have any effect at all. But they said that they did a little research. 12 weeks or more is still effective, but if we will be specific to the 16 weeks, they don't have answer for us.
Right, and still talking about the inoculations, we've been hearing about the inoculations for Thai nationals. Now let's look at the French nationals in Thailand. The inoculation for these people aged 55 and over begins today for 2 weeks at 8 hospitals across the country. This is according to the French embassy in Bangkok. The inoculation of French nationals in Thailand is taking place at Bangkok hospital facilities in the capital, Chiang Mai, Hua Hin, Pattaya, Phuket, Khon Kaen, Got Samui and Udon Thani, but the vaccination is only based on appointment basis. Vaccination is on a voluntary basis and free of charge, as it is being subsidized by the French government, the embassy statement reads. And the vaccine being administered to French nationals in Thailand are from Johnson & Johnson.
Yes, so Johnson & Johnson, good thing about those is only one shot and done. I think it's the only one only one brand that make one shot COVID-19 vaccine.
Definitely.
And talking about vaccine is, like I said, one of the factors that makes a lot of countries start opening up. California, state of California in US is one of the places that they drop the mask measures and also allow the restaurant to fully open already. So we have a report on some Thai businesses that try to get back on their feet. And even though all these disease control measures were dropped, they still enforce it just to be safe. Let's take a look.
Around this time last year, the United States faced a gravely serious COVID-19 situation. Over 20,000 new cases were being recorded every day before the crisis reached its peak in December, when daily infections reached into six figures. Things have, however, turned around pretty impressively now after mass vaccinations began. Statistics from the U.S. Center for Disease Control and Prevention shows daily infections less than half those recorded in the same period last year. The decline is thanks to mass vaccination. In the U.S., over 45% of the population is now fully inoculated, according to the CDC. The U.S. is now going ahead with recovering its society and economy. Masks are off and people and businesses can return to normal. California state government, for example, last week announced the lifting of social distancing and mask-wearing mandates. Some members of the Thai community, however, appear reluctant to jump on the bandwagon, still worried about the deadly virus.
กฎของร้านก็ยังน่าจะใช้ตัวเดิมอยู่ก็คือใส่หน้ากากเข้ามาเหมือนเดิมค่ะเพราะลูกค้าส่วนใหญ่ก็ค่อนข้างจะกลัวแต่เราก็ไม่รู้ว่าลูกค้าจะยอมใส่หรือเปล่าอันนั้นนะแต่ว่าการที่เข้าร้านมาเราก็จะบอกว่าก็สวมแมสอยู่นะคะก็จะบอกขั้นตอนนี้
Samniang Pingwong, the owner of Wing Lagon Thai Spa, located not far from Santa Monica Pier and Venice Beach, a popular tourist destination in California, admitted that her parlor will maintain the mask measure for a while to ensure safety.
คือเราทำงานนวดนะฮะก็คือแบบว่ามันก็ต้องคือระบบสัมผัสระบบอะไรพวกนี้มันจะใกล้ชิดแล้วก็เสี่ยงซึ่งเราก็ไม่รู้ใครเป็นโรคอะไรหรือยังไงแต่ว่าถ้าโควิดมันมีวัคซีนแล้วอย่างเงี้ยแต่ว่าทางร้านของเรายังป้องกันอยู่นะคะใส่หน้ากากค่ะใส่หน้ากากลูกค้าเข้ามาแต่ละคนก็คือก่อนที่จะเข้านวดก็คือให้ไปล้างมือก่อนทุกครั้งก่อนที่จะเข้าห้องนวดค่ะ
Similarly, Natamon Lee Pasatsin, the owner of Red Chicken, a restaurant in San Gabriel Valley, a suburb of Los Angeles, insisted on keeping the COVID-19 measures for a while.
ก็คิดว่าอาจจะรอดูก่อนค่ะสักวีคนึงนะคะว่าส่วนใหญ่แล้วลูกค้าที่มาค่ะใส่หน้ากากไหมเพราะว่ามันเพิ่งเปิดค่ะยังไงก็อยากจะดูความมั่นใจก่อนนะคะเพราะว่าหลายๆคนก็อาจจะไม่ได้รับวัคซีนทั้งหมดนะคะ
The sense of uncertainty lingers not only in businesses but in everyday life.
เดี๋ยวนี้เขาเปิด 100% แล้วครับเมื่อวันอังคารที่แล้วหน้ากากไม่นี้ที่ต้องใส่แต่ว่าถ้าคุณอยากจะใส่เขาก็ไม่ว่าถ้าเกิดผมเข้าไปในหมู่คนอย่างเงี้ยผมจะใส่หน้ากากเพราะผมไม่ไว้ใจแต่ผมฉีดยาแล้วแต่ว่าเราก็ไม่ไว้ใจอยู่ดี
เท่าที่ดูนะคะในรัฐแคลิฟอร์เนียตอนนี้ใช่ไหมคะส่วนใหญ่หลายๆคนก็ได้รับวัคซีนกันแล้วนะคะคิดว่าการที่เราเปิดไม่ใส่หน้ากากทุกคนน่าจะออกมาทานข้าวนอกบ้านกันเป็นแฟมิลี่มากขึ้นนะคะคิดว่าน่าจะเป็นผลดีนะคะสำหรับเศรษฐกิจตอนนี้นะคะสำหรับร้านอาหารไทยทั่วๆไป
Though the situation has improved and the government is ready to help people return to their normal lives, it will still take some time for them to adjust to the changing situation. businesses and services may have to try to find a way to build trust during this time or be prepared for customers' changing behavior.
And that's all the news we have for you in this edition of Thai PBS World Tonight, but you can follow us on our website, thaipbsworld.com, for more news, any other kind of news, lifestyle, food, travel, politics, in-depth explainers, just check it out. We also have social media. We have YouTube, Facebook, Twitter, Instagram, and TikTok.
And that wraps up tonight's edition of Thai PBS World Tonight. Thanks for watching, stay safe, and we'll see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ